Abuse is defined as the wrongful use and mistreatment of another, and the abuse is usually perpetrated by someone the person knows. Victims of abuse are found across the lifespan: spouses, partners, children, and elderly parents. Various types of abuse include domestic abuse, child abuse, elder abuse, and rape. Many survivors of abuse suffer long-term emotional trauma like PTSD and dissociative disorders, depression, and substance abuse. Victims of abuse may have physical injuries that need medical attention and psychological injuries that can have a broad range of responses. Some may be agitated and visibly upset, while others are withdrawn and aloof. Domestic violence may be hidden for months or years because the victims are afraid or they suppress their anger and don't tell anyone. Survivors frequently feel guilt, shame, degraded, and dehumanized. Kids especially may feel that it's their fault. Survivors of abuse can have problems relating to others and trusting authority figures. Nurses need to be sensitive to an abused person's need to feel safe, secure, and in control of their body. Family violence includes spouse battering, neglect, physical, emotional, and sexual abuse of children, elder abuse, and marital rape. Sometimes family members tolerate the behavior that they would never accept from a stranger, and the home that should be a safe place is the most dangerous place for them. Some common characteristics of violent families include social isolation. Members of the family keep to themselves. They typically don't invite people over or tell them what's happening. Abuse of power and control. The abusive family member usually has a position of power and control, not only physical, but also economic and social control. They're the person who makes the decisions, spends the money, and spends time with others. They belittle and blame the victim. Alcohol and drug abuse. The abusive person is likely to use alcohol or other drugs. The majority of victims report that alcohol was involved in violent incidents. Alcohol may not cause the abuse, but it does diminish inhibitions and can make the violent behavior more intense and frequent. Intergenerational transition process. This shows that patterns of violence are passed on from one generation to the next through role modeling and social learning. Children who witness violence between their parents learn that violence is the way to resolve conflict. Domestic violence affects families of all ethnicities, races, ages, national origins, sexual orientations, religions, and socioeconomic backgrounds. However, immigrant women are especially at risk. They face different legal, social, and economic problems than those who are U.S. citizens. They may come from a culture that accepts domestic violence. She might believe that she has less access to legal and social services. If she isn't a citizen, she may be forced to leave the U.S. if she seeks legal action against her husband or tries to leave him. Cultural dynamics may not allow her to leave her husband. She may not have the resources to leave, work, or go to school. Language may be an issue. Can she call 911, learn about her rights, or get shelter? Intimate partner violence is the mistreatment or misuse of a person by another in the context of an emotionally intimate relationship. Spouses, partners, boyfriends, girlfriends, etc. The abuse can be emotional or psychological, physical, sexual, or a combination. Psychological abuse is name-calling, belittling, screaming, yelling, destroying property, threatening, refusing to talk to the person, or ignoring them. Physical violence is shoving, pushing, battering, choking. It can involve broken bones, internal bleeding, brain damage, etc. Sexual abuse includes assault during sexual relations, biting the nipples, pulling hair, slapping, and rape. 24 people a minute are victims of intimate partner violence in the United States. Victims are primarily women, and many experience more than one episode of violence in a year. 15 to 25% of pregnant women experience violence during pregnancy. This can lead to miscarriage, stillbirth, and other problems. Intimate partner violence occurs in same-sex relationships with the same frequency as heterosexual, but the victims have fewer protections. 7 states define domestic violence in ways that exclude same-sex couples. 21 other states have laws that designate sodomy as a crime. The same-sex batterer has another weapon: revealing the partner's homosexuality to family, friends, employers, or so forth. An abusive husband often feels that his wife belongs to him and can become increasingly violent if she shows any sign of independence, like getting a job or threatening to leave. The abuser usually has strong feelings of inadequacy, low self-esteem, poor problem-solving skills, and poor social skills. He is usually emotionally immature, needy, irrationally jealous, and possessive. The victim is usually dependent personally and financially and may see herself as unable to function without her husband. She frequently also has low self-esteem and internalizes the criticism and believes that she's to blame. She may also fear her husband, that he will kill her if she tries to leave. Women have a 75% greater chance of being killed when leaving an abusive relationship than those who stay. The typical pattern of violence begins with the initial episode of violent behavior, then regret where the husband apologizes and promises it will never happen again. They may profess their love, buy flowers, take them out to dinner, and so forth. This is also called the honeymoon period. Then the tension building phase consists of arguments, complaints from the husband, and it ends in another violent attack, and the cycle starts over. Initially, the honeymoon phase may last for some time, but over time, the attacks become more frequent. The period of remorse can disappear completely, and the severity of injuries gets worse. Most abused people will not directly seek help, so nurses can help identify them and offer caring and support. Some questions to address safety are the SAFE questions. Stress and safety. Do you feel safe in your relationship? Should I be concerned for your safety? Afraid and abused. Have you ever been physically hurt or threatened by your partner? What happens when you and your partner disagree? Friends and family. Are your friends aware that you've been hurt? Does your family know about the abuse? Emergency plan. Do you have a safe place to go and the resources you need to get there? If you're in danger now, would you like help locating a shelter? Something to be aware of as the nurse is to make sure you're asking these questions with the victim alone. Don't ask in front of the partner as they may be too scared to answer. More than half the states have laws requiring police to make arrests for at least some domestic violence crimes. Sometimes the abuser will calm down after the police talk to him. Sometimes they're held for a few hours or overnight. Frequently, the abuser will retaliate once they're released, making the victim even more afraid of calling for help. A restraining order can be obtained from the person's county of residence that prohibits the abuser from approaching or contacting them. They only provide limited protection as the abuser can violate the order and severely injure or kill before the police can get there. A civil order of protection may last longer than a restraining order and offer more options. They can require advocacy counseling, shelter, require the abuser to stay away for up to 5 years, may require child support, and for the abuser to give up the home. Shelters can provide temporary housing and food for abused women and children who leave. Shelters might be crowded, and they may have waiting lists, and they are temporary. Therapy can help with the emotional and psychological injuries from abuse. It may be individual therapy, group therapy, support groups, and treatment for anxiety and depression. Child abuse is the intentional injury of a child. It can include physical abuse, neglect, failure to prevent harm, failure to provide adequate physical or emotional care, abandonment, sexual assault or intrusion, torture, or maiming. Sexual abuse involves sexual acts performed by an adult on a child younger than 18 years old. Neglect is malicious or ignorant withholding of physical, emotional, or educational necessities for the child's well-being. Psychological abuse includes verbal assaults, blaming, screaming, or name-calling. In 2013, 678,932 victims of child abuse and neglect were reported to Child Protective Services. 27% were under 3. About 1,520 died from abuse and neglect in 2013. About 75% are father-daughter incest. Parents who abuse their children often have minimal parenting knowledge and skills. They may be emotionally or financially unable to meet the need of the child. They may be emotionally immature, needy, and unable to meet their own needs. They may view the child as their property. There's also a tendency to raise their children the way they were raised, so if the adults were victims of child abuse, they may now be the abuser and continue the cycle of family violence. Identification is important, and nurses are in a key role. Some things to watch for: fractures, burns, or lacerations with no reported history of trauma. A delay in seeking treatment for a significant injury. History that is inconsistent with the severity of the injury. Inconsistencies or changes in the child's history during the evaluation. Unusual injuries for the child's age or level of development. A high incidence of UTIs, bruised, red, or swollen genitalia, tears or bruising of the rectum or vagina. Evidence of old injuries that were not reported, scars, untreated fractures, and multiple bruises. Nurses are responsible for reporting suspected child abuse, not to determine whether or not it occurred. The first step of treatment is to make sure the child is safe, which may mean removing the child from the home, which is also traumatic. A psychiatric evaluation may be done to help the child deal with the trauma of abuse. Treatment may also involve play therapy and family therapy. Parents may be required to undergo psychiatric or substance abuse treatment. Foster services may be needed if the child isn't able to return home right away. Elder abuse is the maltreatment of older adults by family members or others in a caregiver role. It may include physical, sexual, and psychological abuse, neglect, self-neglect, financial exploitation, and denial of adequate medical treatment. It's estimated that 1 in 10 people over 65 are abused or neglected by their caregivers, but few elder maltreatment cases are reported. Most victims of elder abuse are 75 and older. 60 to 65% are women. Abuse is more likely when the victim has multiple chronic mental and physical health problems, or when they're dependent on others for food, medical care, and other ADLs. Those who abuse elders are almost always in a caregiver role. Elders may be reluctant to report the abuse because the abuser is a family member they want to protect, like a spouse or a child. They may also fear going into a nursing home. Signs are variable depending on the type of abuse. The elder may have bruises or fractures. They may not have glasses or hearing aids that they need. They may not have food, fluid, or medications. They may be restrained to a bed or a chair. They may not have access to their finances. It can be difficult to tell if an elderly patient's condition stems from chronic illness or from abuse. Some signs to watch for: frequent unexplained injuries, seeking medical attention from various locations, reluctance to get help for injuries or a denial of their existence, disorientation or grogginess from a misuse of medications, fear or edginess when the caregiver is present, changes in their mood or behavior, helplessness, a hesitance to talk openly, anger or agitation, withdrawal or depression, unpaid bills, poor personal hygiene, dirt, fecal, or urine smell, and rashes, sores, or lice. Rape is a crime of violence and humiliation of the victim that is expressed through sexual means. It's the perpetration of the act of sexual intercourse with a female against her will and without consent, whether her will is overcome by force, fear of force, drugs, or intoxicants. It's also considered rape if the woman is not able to exercise rational judgment because of mental deficiency, or if she's younger than the age of consent, which varies from state to state, but is usually 14 to 18 years old. It does not have to be full penetration to be considered rape. Only slight penetration of the vulva is needed. Erection and ejaculation are not necessary. The woman who is raped may also be beaten and injured. Rape can happen between strangers, acquaintances, married people, and those of the same sex, although 7 states do define domestic violence in a way that excludes same-sex victims. 26% of rapes are committed by strangers. Date rape or acquaintance rape can happen on a first date, a car ride home, or when the two have known each other for a while. It usually happens near colleges and universities. Rape is a highly underreported crime. Less than half are estimated to be reported, and it's usually because the person feels shame and guilt, they fear another injury, or they feel that they don't have recourse in the legal system. Victims can be any age. Cases have been reported from 15 months to 82 years. The highest incidence occurs between 16 to 24, with girls under 20 making up 80% of the rapes reported. Rape commonly occurs in the woman's neighborhood, usually inside or near her home. Most rapes are premeditated. Male rape is also significantly underreported. It can occur between strangers and gay partners, and is most commonly found in prisons and maximum security hospitals. Alcohol is involved about 34% of the time. Most men who commit rape are between 25 and 44 years old. About almost 75% have a prior criminal history. There are 4 categories of rapists. The power assertive rapist. This person wants to dominate and control the victim. They may cruise bars or the internet to find someone. They act macho and may repeat the act with the same victim. The anger retaliation rapist. This one wants to punish the victim. He hates women and causes substantial injury. He sees himself as masculine and action-oriented. He may spend time online in chat rooms talking about hating women because of some injustice. The power reassurance or opportunity rapist. He commits rape when the opportunity presents itself, maybe while committing another crime. He frequently has low self-esteem, may collect souvenirs, and thinks the victim liked it. The anger excitement or sadistic rapist. He wants to hurt the victim and the victim may be killed. He acts out fantasies, carries a rape kit, learns better ways to stalk victims, finds victims on the internet. The feminist theory proposes that women have historically served as objects of aggression, dating back to when women and children were considered the property of men. It wasn't until 1982 that a man was convicted of raping his wife. The physical and psychological suffering of victim experiences is severe. Medical problems can include injury, sexually transmitted diseases, pregnancy, and lingering medical complaints. One study found that women who had been raped considered themselves less healthy, saw doctors twice as often, and their medical expenses were twice as high as those who had not been victimized. Victims of rape may experience fear, helplessness, shock, disbelief, guilt, humiliation, and embarrassment. They may avoid the place or circumstance of the rape, give up activities they enjoyed before, experience depression, anxiety, PTSD, sexual dysfunction, insomnia, impaired memory, and contemplate suicide. Some common myths about rape: that it's about sex. Women who dress provocatively are asking for trouble. Once a man is aroused, he can't control his actions. Walking alone at night is an invitation for rape. Rape can't happen between married people. Rape is exciting for some women. Rape usually happens between strangers. And rape is a crime of passion. When a woman comes in reporting rape, the physical exam needs to happen before she showers, brushes her teeth, douches, changes clothes, and drinks in order to preserve any evidence. However, she may have done some of these things before coming in for help. Rape kits are usually found in the ER, and it's used to collect evidence. The nurse asks the victim what happened. Questions need to be asked gently and carefully. The physician will usually collect physical evidence. The victim will need immediate support, people that they can express their fears and rage to and will believe them, like the nurse, doctor, friends, family, and law enforcement. Education about rape and the needs of the victim is an ongoing process for healthcare workers, law enforcement officers, and the general public. Giving the victim as much control as possible is important, so allow them to make decisions whenever possible about who to call, what to do next, and whether or not to file charges. Prophylactic treatment for STIs and pregnancy are offered. Therapy should be supportive and focus on helping the victim regain a sense of control. School violence can include homicide, suicide, theft, and violent crimes. In 2014, it was reported that there were 26 homicides, 14 suicides, and 5 legal interventions that happened at school. For students 12 to 18, 37 out of 1,000 students were victims of violence, and 15 out of 1,000 were victims away from school. The CDC has been working with schools to develop curricula that emphasizes problem-solving skills, anger management, and social skills development. Bullying includes verbal aggression, physical acts like shoving or breaking bones, shunning or ignoring someone, and cyberbullying. Adolescent suicide, substance abuse, self-harm ideation, and depression are all correlated to bullying. Hazing is prevalent in both high school and college. Victims may be humiliated or sometimes subjected to illegal activities. When children witness violence, they experience stress-related symptoms that increase with the amount of violence they see. Witnessing violence can lead to future problems with aggression, depression, relationships, achievement, and abuse of alcohol and drugs. Large-scale violence, like a terrorist attack, can lead to stress, depression, anxiety, and PTSD in both children and adults. Who remembers where they were for 9/11? Will you ever forget it? Early intervention and treatment are key to dealing with victims of violence. This may include counseling and other ongoing treatment. Become comfortable asking difficult questions to screen everyone for abuse. Even when it's difficult, listen to the stories of violence and abuse without showing outward signs of your feelings. Make comments like, "That must have been terrifying," or "Sounds like you were afraid for your life," to be supportive and to convey acceptance. See the victim as a person of worth and dignity, regardless of the circumstances. If the patient feels acceptance from the nurse, they may be able to gain some self-acceptance, which will help them to heal. Nurses with a personal history of abuse or trauma may need professional help to deal with their own issues before trying to help others.